Hi, my name's Les, and today I want to talk about one of my most profound and effective therapies, and I use it routinely. I'm currently working at a women's treatment center called Hartwood, and it's a 3-month residential program, so these women come in with alcohol and drug problems, and along with that comes a lot of trauma, a lot of emotional issues, a lot of craving, anxiety, insomnia, physical pains of all kinds. And emotional freedom technique, also known as tapping, is one of my, it's so profoundly effective, and anybody can learn it, and no matter where you are, who you're with, whatever, you got your tools right here. And it's based on Chinese medicine, the meridians and acupuncture points, and but with a Western medical twist, or Western psychological twist. So what we do at the beginning of emotional freedom technique when we're applying this therapy is we ask the patient or the client, how intense is their misery? How painful is your problem? And on a scale of 1 to 10, a subjective unit of distress is referred to it. And often it will be a 10 or it'll be a 12. I mean, sometimes the issues that I see quite routinely are extremely painful and emotional. And so we identify the problem, and on a scale of 1 to 10, it could be an 8, whatever. But anyway, so we got a focus, and I just asked the person, the client, to allow themselves to feel how they're feeling right now with a craving of maybe a 10 out of 10. They're ready to bolt. They're ready to hit the road and carry on that lifestyle. But if they knew this technique, they would be able to calm themselves down immediately and address some of the issues, which no doubt will surface during this period of treatment. So, starting off, we use a point here. It's called small intestine 3. And we just tap on it, just a light tapping, and we acknowledge the problem. Typically they'll ask you to accept your problem, but a lot of people are not quite there. So I always start off with, I acknowledge the way I'm feeling. I'm really stressed out and anxious. I'm craving, whatever it might be. And we say it 3 times. I acknowledge the problem, this craving issue. I completely accept myself with this issue. And deeply and profoundly, I love and I honor and I accept myself the way I'm feeling right now. Stressed out, underpaid. And I start right at the top. This is what we call do 20. There's a number of points. It's a line of energy that comes up the spine and comes over the top right to about here. It meets up with the conception vessel, which comes up to, they meet in the mouth. So I just tap on that point and keep my mind focused on the issue. Anxiety, stressed, worries, doubts, fears. The more specific you can be, it might be an incident that you've, boy, that was good. It might be an incident that happened, a traumatic event, a love pain, relationship issues of all kinds. Or you're just missing home, you're homesick. And typically I will be tapping on the person, but they can just watch me do it as I tap on myself, and they just tap the points. All the while I keep them focused, whatever it is that is bothering them at that time. So here we've got bladder 2, gallbladder 2. That means the beginning of the energy pathways. Stomach 2. They start in the eye, the first accessible points. And stomach 2, because it goes up here, down through the stomach, down to the toe, next to the big toe. So we call it the stomach meridian. And this one here is the end of the dew meridian. I think it's dew 24, governing vessel. And then this one here is the end of the conception vessel. And just a little tapping, a little rubbing, and sometimes it's the stimulus, the mechanical stimulus on the bone actually that creates what's called piezoelectricity. This is kidney 27, the end of the kidney pathway. Starts at the bottom of the foot, comes up to here, meets up with another meridian. And actually, see, the collarbone, they call it because it's right on the collarbone or just below the collarbone. And there it is, right there. You can, if you feel along there, you'll feel little holes. There's kidney 27. There are little divots in the tissues. And so the closer you are to the point, the better. And then they got one here. This is spleen 24, I think it is. And I use 4 fingers. And it's a point which you can easily tell because you can feel it. When you tap on it, it feels like there's a bruise there. Not unusual with acupuncture points. It can be tender or sensitive. And actually there's a point there. And then I come back here, kidney 27, all the while keeping my mind, my attention on whatever it is. And then conception vessel, governor vessel, stomach, 2, gallbladder 2. All right, now, issues resolved. You ask again, how do you feel about your craving now? Where is it on that scale of 1 to 10? And it will often be down to a 0. If it's still there to some extent, just get the person to focus on what is it that's still bothering you about that issue. Is it about a person that you were using with it? Whatever, any issue. They say it's like cutting down a tree. You can knock down one tree, but sometimes one tree will knock down the other tree, and all the forest just collapses, and then it's totally resolved. But sometimes you don't get the entire issue resolved with one round. You might want to do another round. But it's so easy, and it's free. And I don't know where I'd be. I learned this technique from Dr. Lee Poulos, who was a very famous psychologist in town, and he taught me hypnotherapy as well initially, and often the emotional freedom technique, as you tap on the points, it's very clear to me as a hypnotherapist that the person is entering a trance state. And a trance state basically means we're sending those messages right into the subconscious mind, having a very profound biopsychosocial, profound emotional release on whatever it is that you're trying to treat or addressing. But I would highly recommend it. Dr. Gary Craig, he wasn't a doctor, but he was a heck of a therapist. He created a video, and I would highly recommend the video. It's a YouTube video, EFT introductory video. Go there, and it's Gary Craig himself talking you through, having many other people treating themselves and each other and so on, and it is just the most excellent video, and it will inspire you to carry on and learn this technique and use it frequently. And whether somebody else does it with you, I incorporate a tapping technique, not a tapping technique, but EMDR technique, where the EMDR is typically they're waving their finger back and forth and you're following the finger as you're processing. But you can also, I could tap here. It would have much the same effect, but the women have their hands on their knees, and I just tap one side as I repeat. Well, that's more for a trance state, but anyway, so that's emotional freedom technique, and if you liked the video, thought it was worthwhile, come back, learn a little bit more, learn some of the other techniques that I have to share. I've been in the addiction field for 40 years, and prior to that, I lived a life of addiction, not so much personally, but in my family, and it profoundly affects the entire family. And so that got me into the field of addictions for my own therapy. And again, I've treated myself a million times for many different issues simply with bio-electrotherapy and emotional freedom technique. But anyway, that's a wrap. Push the button for if you like, or Take good care and have an enjoyable day.